Hi, this is Sachin Kumar from University of Arizona, and this is ACC 2013, and it's my privilege and honor to be here with Dr. Greg Fonarow from UCLA, who needs no further introduction, as you all know. It's a privilege to be standing next to you, Dr. Fonarow. First question, what is the most exciting thing for you at this session, ACC 2013, both in general sessions as well as heart failure?
So we've really seen here a number of important clinical trials presenting, but unfortunately the results in terms of heart failure are somewhat disappointing. We realize that we've got a number of really fantastic evidence-based neurohormonal antagonists for heart failure and reduced LVEF, as well as some devices. But the trials presented here so far have really shown the challenges in moving beyond that. Saw a trial of trying to correct mild to moderate anemia in patients with heart failure. There had certainly been intriguing data going into that, as anemia is an independent risk factor for mortality, but RED-HF that was presented and published online in the New England Journal of Medicine did not show an improvement in outcome or a reduction in hospitalization, so we'd have to classify that as disappointing. A study I was directly involved with in the steering committee, Astronaut, to test whether further neurohormonal blockade, adding a direct renin inhibitor to patients hospitalized with heart failure on top of standard of care therapies would improve outcomes, in fact showed no improvement in clinical outcomes overall at 6 months or at 12 months, though there was an interesting interaction around patients with and without diabetes that will require some further analyses. One area where we have no evidence-based therapies, heart failure and preserved EF. That trial, RELAX, was also presented. There was a lot of enthusiasm about phosphodiesterase 5 inhibitors for heart failure and preserved EF. Unfortunately, in the well-designed heart failure network trial, did not improve exercise capacity, and even for the clinical composite, if anything, was heading in the wrong direction. So just highlighting that we continue to have significant challenges for that patient population. But the good news is this is a well-designed trial in this population. We can characterize these patients, get them enrolled in a trial, and hopefully the next trials that come up will identify a more promising therapeutic agent and ultimately have success.
That's wonderful, Fonarow. One last question. What is the most interesting thing that you did apart from ACC in San Francisco?
So this is a great city, so seeing the Golden Gate Bridge again is a highlight of a trip to San Francisco. But certainly most of my time has been spent here at the convention center soaking up all the great science.